Hello, everyone. This is Loren Israelson, President and founder of the United Natural Products Alliance, or UNPA. It's my great pleasure to have as a guest Ellen Schutt, Executive Director of GOED. GOED is the global organization for EPA and DHA omega-3. They are the world's leading trade organization that is the champion of the cause for omega-3s, and they do fabulous work. And I know them well because we often shared for a number of years. So they're both friends, colleagues, but also have been office mates as well. So Ellen, it's a pleasure to invite you. Ellen is the executive director and leads the affairs of the organization. Today, we're talking about GOED's new clinical study database. I had a chance to recently look at this database, and I can tell you I was overwhelmed. It is remarkable, both in the depth, breadth, and technology that GOED's made available to literally take all that is known, the scientific literature about omega-3s, and put them into a searchable database. So first, congratulations, Ellen. That's a big deal.
Thank you. It was quite an undertaking.
How long did it take to build this out?
We started working on this in 2016, so I guess 6-7 years. And I think at the time we, of course, had no idea really what we were getting into. And I think the biggest challenge is because there's 40,000 studies on omega-3s and almost 4,000 human clinicals, there's so much research to look into. And all of that really needed to be handled by people, not by artificial intelligence. So the undertaking of this whole project required a lot of hands.
Clearly. I understand that you initially intended to use this for in-house purposes, but clearly you realized that there's more to it than that. What is GOED doing with it now?
So when we started building this database, it came out of frustration, and many of your audience will certainly appreciate this, that there were a lot of negative news stories coming out around the time that we started building this. And the time it would take us to be able to rebut the points in, I can remember one very specific one in the New York Times that said, fish oil claims not supported by research. And of course we knew that wasn't true, but to be able to pull all of the documentation to show the other side of the story took weeks. And now we can do that in minutes. And so that was really what we started building this for, was to be able to understand quickly the entire body of evidence around omega-3s. So this is something that will help us now when there's a news story out or a challenge to the science, but it also helps us understand where the gaps are in the science if we need to further build in the area of cognitive development, for example, or what's going on with exercise recovery, some of these more emerging areas. So we can do all of that. But if we are interested, then I'm sure we have member companies or other companies in the industry who are also interested and want to be able to understand what the science says for their own research or product development or marketing claims, et cetera. So all of those ways this tool can help.
So in short, it has tremendous commercial value to industry. Individual companies could use it for, say, structure function claim, substantiation, to support international registration of products, safety assessments, GRAS affirmation, et cetera. That's a lot. If a company wanted to license the current database, can you walk us through that process and what the cost might be?
Yeah, sure. So the database has two different sections, more of a high level, we call it the abstract search, a high level overview that might be used more for someone in marketing who wants to, at a glance, know what the science says about omega-3s and X. And so that is available on an annual or quarterly basis, and for $3,000 a quarter. You can also license the entire database, which gets into the nitty-gritty details of, I want to know the difference in this particular outcome for men versus women, or for a dosage of 500 milligrams or 1,000 milligrams. So if you really need that level of research, you can license the entire database, and that's $10,000 a year. But there's plenty, we've had conversations now that this has been out for a couple months with companies who don't necessarily need that full license, but they want just a project, or they don't want to, or don't have someone on staff who can dig in and figure out all of it's a pretty complicated, not complicated, sophisticated tool. So they are looking for us to do what we're calling a concierge project for them, to say, I want to know this answer. Can you look this up, give me all the data and the charts and the summary of everything in a deliverable. And so that's the other thing we're offering that we think is going to be really valuable for those companies doing more of just a one-off project that they just need a very specific answer.
Makes perfect sense. So in that respect, I understand that the technology that drives this and the software is something that would apply very directly to other nutrients in the industry. We have hundreds and hundreds of other categories, very much like omega-3. And it would certainly make sense to see if that engine of technology you've developed, co-developed, could be put to good use in other parts of the industry. What are your thoughts on that, Ellen?
Yeah, we think this is a really, really interesting way to use the database, because we own the license to the database itself, but we worked obviously with a software company who did all the coding for it. So we could, if anyone is interested, license the framework to a company that's into carotenoids or Ayurvedic herbs or probiotics, any other nutrient category, and it could be a trade association, or it could be a company that wants to understand what's going on with their particular nutrient. And so the easy part is the licensing and the software development, and they take out the words omega, EPA and DHA, and put in lutein or zeaxanthin or whatever the other terms are. The question mark part is, how much research is there, and then how long does it take to extract that data? So that's the time limiting factor. That 4,000 studies took 5 years. So it depends how many people you have doing this and what body of research you're trying to really extract. So I think we'd love to have those conversations with individual organizations that are interested, but that's really what the question is how much research are you trying to understand?
That makes sense. Well, I want to thank you for coming on today. This is a very important development in the industry. I think you have done something never done before. It's a brilliant piece of work, so congratulations to the team. And we will certainly circulate this as widely as we can, and would love to support GOED in using this new technology and tool to best advantage for the broader supplement industry. So again, today it was with Ellen Schutt, Executive Director of GOED, and we were discussing the GOED Clinical Study Database, just released very recently. Ellen, thank you for joining us today.
Thank you. Thanks so much for having me, Loren.
Our pleasure.